Hi, good morning, guys. I'm Dr. Jenny Yusuf, physical therapist and doctor of physical therapy. I am the CEO and founder of Physiogen PT and Wellness and creator and founder of Balance and Fall Support Group. So today is Thursday for our podcast. I will be your host for the podcast for Thanks God It's Thursday for the Balance and Fall Support. So in the Thursday, Thanks God It's Thursday, we always highlight new innovators, CEO and founders in our healthcare professionals. And we are so lucky to have Dr. Cynthia Fox. She is the CEO and co-founder of LSVT Global Incorporation. And we have opportunity to have her today. Dr. Cynthia Fox is from Tucson, Arizona. She did her Ph.D. in speech language pathologist with a minor in neuroscience. Oh, very high tech, right? All right. So by trade, she's a speech language pathologist, and she's our first SLP in our group. All right. So we highlight her. So Dr. Cynthia Fox, and thank you so much for your time and opportunity for this. I know you're very busy global. And all right, tell us about yourself to introduce for our group.
Sure. Thank you, first of all, for having me. And I'm excited to be the first speech language pathologist. I love interdisciplinary care. And I think the more that we can communicate with each other, the better. So that's great. So as you said, I'm currently CEO of LSVT Global, also one of the co-founders. And by trade, I say I'm a speech language pathologist. So I've been doing clinical research really since I've completed my master's degree. I went straight from my master's into my clinical fellowship, which was doing research on the Lee Silverman voice treatment, or today what we know as LSVT loud. And fell in love with research, fell in love with the treatment. And I think the main thing about the treatment, it was the first time I saw such a dramatic impact in such a short amount of time that really had a powerful impact on changing people's lives. And I just wanted to do more of that. So I had the good fortune to continue working at that time with Dr. Lorraine Ramig, who was the initial person who started all the research on LSVT loud. Yeah. And it's just grown. It's been 25 years now since I began that work. And it's hard to believe that it's been that long, but it's been amazing to see our work grow and just the field of Parkinson disease grow and mature.
Exactly. So wow, that's a long time, 25 years, and still growing. Now we're global, right? So I'm also an LSVT BIG certified practitioner, and we have, I would like also our clients to be involved with this kind of very good, great program. And also my colleagues, I encourage them to take their LSVT BIG because I work with PTs. And then we usually couple it with our SLP to be more on loud certified. So thank you so much. You told us about the meaning of the LSVT. So every session we explain it to our clients. And can you tell us the history of how it became the word LSVT and what does it mean?
Absolutely, absolutely. So back in the late 1980s, an organization actually in Scottsdale, Arizona, the Lee Silverman Center for Parkinson's Disease, had reached out to Dr. Lori Ramig, and they had actually developed a relatively, I'd say, novel program at this hospital. Mrs. Lee Silverman was a woman living with Parkinson's disease, and her family had supported the center at Scottsdale Memorial Hospital called the Lee Silverman Center for Parkinson's. So Dr. Ramig was brought in to develop the speech treatment protocol along with one of her former students, Carolyn Mead Bonatati, at that center. And what was unique about the center was patients actually came and stayed for a month. They had daily, 5 days a week, speech therapy, physical therapy, occupational therapy, nutrition, exercise. And again, this was the late 1980s, so it was very kind of ahead of its time. And so as part of developing the treatment, It really began at that center, grew into what it is today. Dr. Ramig then took that clinical work and began her long research career, writing her first R01 research grant to study further the treatment. And so when it really became a protocol and it became time to call it something, it was named in honor of Mrs. Silverman. So that's where Lee Silverman voice treatment came from. Today, we just typically, again, go by the acronym because we've gone beyond voice. So LSVT Loud represents the speech therapy, and then LSVT Big represents the physical and occupational piece of the therapy.
Yes, that's exactly. So the LSVT Loud first, and that's where it originates, to have a big for us therapists, both physical and occupational therapists. So how was the time frame for that? So let's say, is it 5 years or 10 years before you develop the big?
Yeah, so LSVT Loud again started in the late 80s. The first funding grant was 1990. I came onto the team in 94. I was doing my work at the University of Arizona and then stayed on at the U of A for my PhD. And during that process, was able to interact with the physical therapist, Dr. Becky Farley, and she got interested in the work we were doing with Parkinson's, you know, really attended some of the lectures, attended a training course, and, you know, had the good insight that amplitude, intensity, sensory recalibration, the 3 tenets of LSVT Loud, made a lot of sense for movement as well. And so we worked together to sort of think about how do we translate these exercises and these concepts that we were doing in the speech system into movement. And so that work began, and I believe it was around 2000, 2001. The very first training course that we had for LSVT Big Therapists was in 2007. And so we have rapidly accelerated the growth of LSVT Big. There's now some really nice research, always more to do, but there's 2 randomized controlled trials, multiple kind of case studies, retrospectives, and more ongoing research happening related to LSVT Big.
Yes, you told us you have a 2 randomized controlled trials for us for the LSVT Big, and I believe you have 3 for your SLP. And I believe the LSVT Loud, guys, is the only SLP protocol or program for which has many evidence-based or research for more than 30 years, right? With this one. So that's really awesome.
It is, and it's exciting, and I think what's really exciting as well is the research is continuing. It hasn't stopped, and in fact, an article just came out, I believe this week, the e-print, where unique study that actually looked at perception of improvements. Oftentimes in our speech studies, we have you know, trained listeners, trained speech language pathologists who listen to changes, rate changes in things like speech intelligibility. And this study, led by a group at NYU and Dr. Ramig, looked at crowdsourcing listeners. So taking these speech samples and giving them to what we would consider kind of everyday listeners and see, do they notice a difference? And the outcomes were very positive, that it wasn't just a trained user, but typical listeners hear a difference as well. So it's fun to see that the depth of research is there, but we keep studying more to learn more, gain more insight, to hopefully improve treatment outcomes ultimately and make the therapy even better.
Yeah, regarding the research, Cynthia, can you tell us more, some of the conclusion of all those results, to tell our followers and our members how good is the Loud, and also a little bit some for the results and conclusion for the Big, LSVT Big?
Sure. So with LSVT Loud, one of our primary outcome variables, because we're training amplitude or loudness, has to been to look at a measured sound pressure level, you know, loudness. And we've shown, you know, with the randomized controlled trials, we're comparing the treatments that are matched for all variables. So they're equally intensive. They have the same homework, you know, the same enthusiasm from the clinicians, but one variable is different. So we've compared loudness to respiratory training, loudness to no training, loudness to articulatory training. And across all of those studies, while we see some improvement with those other targets, it's not as great and it doesn't last as long. And so, you know, with LSVT Loud, our first RCT, we followed patients out to actually 2 years after treatment. And some of the residual benefits still lasted. What we've expanded beyond then the randomized control trials is to try to look at mechanism. So we've studied changes, for example, in respiratory support, what happens to the articulators, documented improvements in facial expression, and we have 3 published neuroimaging studies as well, looking at changes in the brain.
That's really good.
Yeah, with LSVT BIG, the 2 randomized controlled trials, the first one out of Germany, led by Dr. George Ebersbach, compared LSVT BIG to what they considered at that time typical treatment, usual care, which was a Nordic walking that was done 2 days a week for 8 weeks. So the total sessions were 16, but they were not LSVT, where it was 4 days a week for 4 weeks. And then the third arm of that therapy was home exercise. So they were taught exercises and then unsupervised practice at home, an hour a day, 4 days a week for 4 weeks. And when they looked at outcomes, their primary outcome was change in the motor score of the United Parkinson Disease Rating Scale. And this was rated blindly, you know, with the raters not knowing which group the patients were in, which time point. And what they found was only the group that received LSVT BIG had statistically significant improvements in that score. And they followed them out to 16 weeks, 4 months, and they were maintained to that point.
Awesome. That's amazing, right?
Yeah.
Yeah. Cynthia, can you show us some of your techniques for because I am already the LSVT BIG Loud, right? So I have idea, but I want to just say kudos to your group because the course is wonderful. It's really alive and entertaining. I attended, of course, the live because now we're doing some of the Zoom, and then it's really good that there's an exam after. It is on theory and then laboratory, and then there's an examination after and practicals. So for the LSVT Loud, can you show us some of the techniques, like how we treat the clients? I remember we watch a video and then you just do like,
yeah, sure. Yeah. So the LSVT Loud has 3 core daily tasks. One of them is sustained phonation or sustained voice. So that's a nice and patients hold that as long as they can with good, healthy loudness. And the goal of that is really to improve respiratory laryngeal coordination and kind of support for the voice. We see that as a way of rescaling amplitude that we then train into functional speech. The second exercise then is directional. So people with Parkinson's get a very monotone voice. So it's flat, it loses that inflection. So we want to work on that. So now we go up high and down low. Again, with the focus on loudness and good quality voice, but working to modulate loudness so then again we can carry that over into conversational speech. The third daily exercise are what we call functional phrases. So we have patients come up with 10 phrases or sentences they say absolutely every day. It can be things like, where are my glasses? Or good morning. And we practice those 5 times a day, every day. They never, ever change. The goal of those is that when a person is at home and they're like, honey, where are my glasses? It reminds them or cues them or hooks them into thinking about, oh yeah, I'm supposed to use my loud voice. So that's kind of the first half of the session. The second half of the session then is to take that loudness that we've scaled up with these basic exercises and systematically train that into speech. So over the course of the 4 weeks of treatment, we increase length of utterance. So we're building endurance. We go from, for example, single words to phrases to sentences to paragraphs to conversation, but also complexity of speech. So
Yeah.
again, starting simple with reading off a page up to conversation with distractions and cognitive loads. And we tailor all that practice to each individual. So we practice reading material that's interesting to them. We incorporate their long-term communication goals, whether that's for they're still a teacher and perhaps they're still working and they have to, use that voice, or maybe they're retired but they have hobbies and support groups they go to.
Yeah.
So it becomes, even though it's a standardized protocol, and this would be true for both LSVT Loud and LSVT Big, it's very much tailored and personalized to each person's individual needs and goals.
That's amazing. I remember the neuroplasticity takes place. That's why you also want sometimes to do the same routine for cognitive training, and that's really, and also the speech language pathologist and the OT over interacts with the cognitive training, right?
Yes, absolutely, absolutely.
I love the video from your success stories that was there, and then she said that in my house nobody listens to me. So now they show the before and then after of the training, and now she's happy, everybody. So even I'm not an LSVT Loud, because we're not speech pathologists, because of our knowledge in some of the video. So I always incorporate my clients to do some everyday, let's say Mr. Smith every day, try to read this magazine loudly. So when you're watching, just read and then just make it loud voice, because we have a little bit of training from the videos that you showed us during the LSVT Big. And so that's really amazing. They listen, we educate, and this is really amazing, great course. So thank you for that. So how about any challenges, Cynthia, that you encounter? How about some dementia or other?
Oh, sure. Right. And, our ideal, we always say earlier is better. We like to get patients into either LSVT Loud or LSVT Big really upon diagnosis. And, sometimes initially the patient says, well, I'm not really having problems yet. And we always kind of walk back and say, you have a diagnosis of Parkinson's disease. What got you to that diagnosis? Because likely then there were some challenges. And yes, medicine will help, but there's so much that rehab can do beyond what just the medicine can do, that it's really important. So sometimes it's, we have to kind of help patients through, maybe some things that they have stopped doing and maybe didn't realize it, that are just more, they can say, well, I can still do it, but it's much more difficult or effortful. And the third thing is sometimes we say, what do you want to not lose? Now's the time to whether it's, again, related to communication or movement, how can we get in there and keep you at the level you're at so you don't lose it and then try to regain it back? So early is wonderful, and they're fun patients to treat, because then we as therapists have to get super creative to challenge them. They'll master the exercises, so then we have to make it more difficult to, with Big, we change surfaces, we change environments, we have cognitive loads, things like that, similar with speech. But then we get to the other end of the spectrum, and when you have patients who are more advanced, oftentimes comorbidities come in at many levels, as well as you mentioned, some cognitive changes and impairments. And we can also have success with those patients. What we're able to do is have flexibility in the program. Again, the protocol does not change, but we can adapt exercises. For speech, for example, for patients who can't hold the quite as long, we may do shorter but more repetitions. Maybe they can't advance as far in the hierarchy in terms of length of utterance, but we'll tailor that. We'll practice at shorter length of utterances. Actually, we put a lot more emphasis on functional speech. How can you communicate with your environment for safety, for health, and things like that. And the same is true with LSVT BIG. If they can't do the exercises standing independently, hold on to a chair. If you can't do it holding on to the chair, we can do them all seated to begin. Some of our home health clinicians have actually helped us develop starting the exercises in a supine position and just getting movement, amplitude, and then being able to work from there. So we treat across the spectrum. Our motto is give everybody a chance. So I would never, based upon a piece of paper, say, oh no, you don't qualify. I say, come in and let's see. And we do stimulability testing. Maybe we do trial treatment. What's so rewarding with some of these more advanced patients, while they may not make, you know, the numerical gains that we sometimes see in our moderate or mild patients, the smallest improvement in function, the ability to decrease caregiver burden, for example, for transfers, the ability for a patient to be able to say, I love you, help me. That smallest bit and that function sometimes has an even greater impact on quality of life.
I like that. I love you. And then they're able to say that nicely. And then also the quality of life. I want to emphasize that we're doing this because we want them to have a quality of life functionally, especially more on us. And for you, it's more on communication with the family and their caregivers. For us, it's more on their ADLs and functions. How you're able to do it is just by removing the button. You know, I always explain to them, this is very important. Just do this. Then they don't understand. What do you mean? When you wash your hands, right? You wash it and just do that.
Yes.
This is the, and then I even just on the spot, just try this. Let's say, and then I will time you and remove your buttons in your polo shirt. I'm timing you now. Okay, let's do this exercise, and then do it again. They were amazed, and that's only a beginning, especially my first session, just introducing what is it. So as you've said, it's a protocol. So we need to stick if it's Medicare covered by Medicare, right? So if we want that LSVT big or loud protocol, it should be 4 times in a week for 4 weeks.
Yes.
So we cannot say LSVT if we just do it alternate days and we just include that in our daily routine, right?
Right. And you know, the reason for that is it's research based. And so, you know, the analogy is to a pharmaceutical. It's gone through testing. The ingredients that make it effective are what are in there. And if you change any of that, you can't expect the same outcomes. And so we very systematically have tested the protocol over many years so that we know these are the key ingredients and these are the elements of success. And yes, while we can individualize bits in there to make it meaningful to each person, we have to have those key ingredients. We also say that, you know, 16 sessions is the minimum dosage. Some patients who are more advanced or more severe may actually need more. You know, and sometimes in skilled nursing facilities where they have the opportunity to see patients 5 days a week, they do, you know, 5 days a week for the 4 weeks. So these patients are actually getting 20 sessions, and that's okay. But we found that 16 is really a critical minimum, so that it's more than just learning, oh, I can do the exercise. That's not the point of treatment. The point of treatment is I've relearned a new way of moving, of speaking. I've gotten comfortable with that. I've made it a habit, and I'm using it in my everyday life. That's hard. It's hard in a neurologically unimpaired system. It's even more challenging when we have something like Parkinson's disease. It takes time, it takes repetition, it takes effort.
Yes. I worked before in a Medicare B company, Fox Rehab, and then we incorporate that. We communicate, okay, OT will come here and then I'll be coming there. So we are able to do that complete LSVT And then that's really easy because it's a med-B. Now I'm in home health, so it's a little bit challenging, especially doing that. But we have a couple of LSVT BIG also for my OTs. So you're
Yep.
able to do that, but if Medicare or something comes up, we just modify, as you've said, we cannot do it, but I always incorporate it, and we call it high amplitude movements, if you're not really doing it consecutively. And I
Yeah.
believe. Mhm,
And
go ahead.
well, I was going to say, in the home health, it can be more challenging, but we definitely have therapists who are successfully able to do that.
Mhm.
Sometimes it takes more coordinated care.
Yes.
The nice thing with LSVT Big, being able to share 2 days PT, 2 days OT, but yet delivering the 4 days of the treatment protocol. And as part of our training, we go through, the process of how do you do that, the separate evals, separate goals, but
Mhm.
a shared treatment. And sometimes it's about education. It's about educating, administration, educating insurance providers. And we've
Okay.
been very successful because the data are there. That just because it's not the way you usually do it doesn't mean that it's not the way it should be done for the patient. So we always, tell therapists, if you come into a hurdle, contact us. We have a database of thousands of clinicians who've probably had that hurdle, and they have great advice for, have you tried this? Have you tried this? What's really exciting, so COVID is terrible. It's disrupted everybody's lives. It's nothing good that we can sort of jump up and down about. But one piece, if we find a little sunshine in there, is that it's accelerated and shown the spotlight on the need for telepractice. I think for speech, we've been a little bit more advanced in telepractice simply because we don't have the movement constraints that I think PT/OT does. But the time has come that telepractice across all rehab is important for many, many reasons.
Yes.
And with COVID now, one of the hurdles has been Medicare has never approved telepractice for speech, physical, or occupational therapists. And finally, just this week, we
Yes.
got the Medicare approval. That I know we got our codes approved a couple weeks ago, but they forgot to approve us as providers. So now we're approved as providers, and our codes are approved so that we can have that Medicare reimbursement. Our goal is that while this are, quote, temporary, that we're able to embrace it and show the value of it and make it permanent so that it does not get rolled back after sort of the crisis is over.
Yes, exactly. So that's innovation, technology. We need to use it. We're able to serve and help more lives by doing this. Because of the pandemic, something comes up, right?
Yeah.
So the LSVT is now global. And then when we say global, so can you describe us more? What are the different locations? You told me last week you're in Japan doing the Zoom training, and I saw as well the students. They are so amazing.
Yeah, right. So we have to date now over 40,000 therapists in 70 different countries that we've trained over the past 25 years. So it's been amazing. Obviously, when we started, English-based, US-based, but really, I think our first courses that went to different languages, Germany and France, I believe were in the year 2000. So again, 20 years ago. And it's a wonderful experience when we're in a country that where English is not the primary language. We use translation. So sometimes it's consecutive. We say it, the translator says it. Sometimes it's simultaneous. The therapists are wearing the headphones and we have translators in the booth. We translate the slides. We translate the treatment materials. So we've trained in person. We have trained in France, Italy, Germany, Brazil, Japan, some other European. Those are kind of primary languages. And our international trainings have really been about being in person because the translation piece was there.
Yes.
Well, again, along comes COVID, where all of our international courses that we had for the spring, we had to change. And so last weekend, we were to be in Japan in person to train 103 physical and occupational therapists. And for the first time ever, we converted that entire course to virtual with translation. So it was amazing that it actually worked as well as it did. We did some pre-recorded bits, we had live sessions. As you can imagine, the time difference was not trivial. It's late at night for us, early in the morning for them. But it was so exciting to see the engagement for the participants. They're hungry for the knowledge. They want to help their patients. And again, I think the innovation and technology allows us to not let things get in the way of what we want to do.
So congratulations with that. Congratulations. And you have wonderful, what do you call these people in your office? Because I also asked them the customer service at one point. I check about my account and everything. You have webinars, you have homework helpers. So tell us more about the resources that you have and how we can connect with you.
Excellent. Yes. Right. So part of our mission is obviously to train the therapist, train speech, physical, and occupational therapists around the world in the treatment. It's either through a 2-day in-person course or a 12.5 to 13-hour online course. So the training is available at any time. Once a therapist is trained, he or she, wherever they work, in whatever practice setting in the world, go out, treat patients, help as many people as possible. We also have support for people with Parkinson's disease. So one of the things is, how does a person with Parkinson's disease connect with the therapist who's been trained? So we have an online database that patients, family members, physicians can search and find therapists in their area around the world who actually delivered the treatment. We have our exercise videos, our homework helper DVDs, or they're actually downloadable or streamable. So it can help patients, guide them through their practice sessions after the treatment is over. Thank you for acknowledging our wonderful staff. We have a really great group of committed people in our corporate office here in Tucson who help anybody, patients, therapists, physicians, connect with resources, connect with training. You know, if there's a hiccup in the online, we'll support you through that. And really with, again, a focus and a mission to help people.
Yes, yes. I like that. Also the homework helpers. So you can buy the DVD. I remember when I did my certification, I have that free DVD. And then this particular client, there's no internet. And then I said, you can even buy it in Amazon or check in their website. And then I just lent my DVD to him, and then I forgot to get it. And then I said, as long as he's using it, I want him to watch on it. And then it's easy. DVD. As long as you have that DVD and watch it. So these are some of the challenges that they have, and we always have an answer. And the continuity of the community. I believe you have another program that you have the community, if you want to do more wellness, just to do the exercises after the graduate of the 4 weeks, they can continue. So what do you call?
Those are our maintenance groups. And so Loud for Life and Big for Life. And this is after patients obviously have completed the individual treatment. Sure, they're prescribed to keep exercising at home. They can use the DVDs. For speech, we also have a software program, the LSVT Companion. But we also, sometimes they like the community. They like the feedback from the therapist. So Loud for Life and Big for Life are group maintenance classes. They are exclusively for patients who've completed the individual treatment already. They sometimes meet once a week, sometimes you know, every other week. Patients get together. Typically a class session, you know, you start with the core exercises, get everybody revved up, and then fun and creative interactive exercises to put the movement, put the speech into practice. What's been another innovation that COVID, this pandemic, has driven us to do is we've converted many of these classes to TeleLoud for life and TeleBig for life.
Okay.
And it has been fabulous. You know, patients are at home, they can't get out, but they miss that connection, and they miss the exercise guidance. So right now we're actually offering all of these classes open to anybody, free of charge.
Wow.
That they can join. We've extended that through the month of May, and so there's information on our website about if you have patients who have been through Big or Loud and are looking for that, that's available. We're also offering and continuing through the month of May introductory classes. So people have never been through Loud or Big, but they want to learn more about it. Every Wednesday, and we go Loud, Big across the weeks. It's just a 30-minute session. We give a 15-minute overview of the treatment, and then 15 minutes, again, of interactive exercises that we can do. Most of these are set up through Zoom.
That's really good. And then the LSVT Global website, and also how we can connect with you. Can we go directly to you, or if you have any questions, things like that?
Yes, our website, lsvtglobal.com. Our email, just info, info @lsvtglobal.com. Ask any questions there, and they will direct you to the right person and the right resource that we have available.
This is amazing. I want to specify also that these programs, I know we highlight more and focus with Parkinson's, but we can also use the LSVT Loud and some of the big movements with other movement disorders. We also have the multiple sclerosis, and what else, Cynthia? So
yes. And I'm glad you brought that up. So LSVT Loud, we initially started our first, so obviously Parkinson disease and the atypical Parkinsonisms. And then we moved into looking at, other types of neural conditions where changes in speech have a soft voice, weakness, things that, we focus on in LSVT Loud. And we've applied it not in randomized controlled trials, but in case studies, single subject designs with published data for speech in stroke, multiple sclerosis, ataxia, children with cerebral palsy, children with Down syndrome. LSVT BIG actually now has 2 publications, case studies looking at using it in stroke as well, with some really nice outcomes. And clinically, again, part of the training, we walk therapists through the process of deciding, is this an appropriate treatment approach to use for this patient or not? So we treat everyone outside of Parkinson's really on a case-by-case basis. But in some situations, it can be really valuable and make a positive impact.
That's really good. What is new to me is more on, you also cover the peds. That's a little bit new to me. I focus on more on elders and geriatrics for us, LSVT BIG. And then the Loud is able to help also the peds. So that's really new. So that's really wonderful. It's a great talk. And you're so busy. You're so busy. What keeps you moving? Well,
just a little on the pediatrics, it's been exciting, and with Loud we've actually have multiple publications now. Actually, that was my dissertation work, was the first application, multiple single subject design in children with cerebral palsy. We've looked at not just the outcomes, but in collaboration with Dr. Carol Bullock at the University of Alberta in Edmonton, actually some of the physiology, and she has we have 2 publications now with neural imaging in these children, pre, post, and follow-up. And so we have both structural imaging with diffusion tensor MRI, looking at white fiber tracts, as well as fMRI. So I'm so proud of that data set, because you think about how hard any imaging study is, then you think about it in children, and then you think about it in children with a movement disorder, and you get them in there 3 consecutive times. She's amazing that she's able to do that, and those data were really super exciting to us.
Wonderful, wonderful. You're so good. You from your initial career is research and everything. For me, I said, oh my goodness, we have a research. So I think I have already a mentor if I need to do a research. Cynthia, it looks like just a piece of cake for you, right?
Well, it's you know, I had a great mentor. Dr. Ramig is a wonderful treatment researcher and has really had a passion. And I think, you know, when you've done the research and you see the outcomes, then that passion spills over to fidelity of treatment in clinical practice. That's what drove us to require certification. It's what drives us to have clinician certification renewal, because the research doesn't count if when it goes into clinical practice, it all falls apart. It's not easy sometimes, but when we've done it in the research and we've shown, wow, look at the potential is, how do we make sure that same quality carries over to every patient who then gets the treatment out in the real clinical world?
That's wonderful. And you have how about courses or books that you read just to improve your what do you call this, your skills?
Yeah, I always like to learn. I think that my greatest learning outside of what I did sort of in research, honestly, has been since we developed BIG, and my ability to work so closely with physical and occupational therapists ongoing. I'm also part of the LSVT BIG faculty, so I do part of the training courses as well. And it's been so wonderful for us to work so closely together. And I think LSVT Loud has gotten better because of it, and I think LSVT BIG gets better because of it. And what we learn in one, we can share with the other. When our patients get both therapies, I think it's so complementary. So I love learning. I like to learn in every particular way. So again, I think formal learning, podcasts are now my new favorite thing and fun to learn. And it's just always all around us, and I think being open to it. I also spent a good deal of learning in terms of leadership. You know, I didn't go to business school, and yet I'm a CEO of a company. And I think a lot of us who open private practices, who move into management, suddenly we're in jobs that our traditional training doesn't train us for. And so I spend a lot of time listening and learning and trying to find people who've been successful. What is it they do to make them successful? Try to bring that back into our practice as well.
That's really good. Yeah. Audible. So while I'm in the car, I'm just listening, leadership, different platforms. So thank you so much. At least you squeeze us in your busy schedule, right? So guys,
I listen to it while I walk, right? So when I go out and take a break to move, then it's a good time. I alternate between something like a podcast and then just music. Turn your brain off.
Okay. So thank you so much, Cynthia. We really appreciate this, and this is a wonderful and great knowledge to know you more and to know the LSVT Global and how it works. So any closure or any tips for us for the Balance and Fall Support Group Aging Adults members?
Yeah, just I want to thank you for having me on, giving me the opportunity to share what we do. If any of you are interested in learning more, there's a lot on our website, on our blog, videos, free webinars, things like that. I encourage you to do that. Amplitude is wonderful for balance, and specifically for Parkinson's, this was developed, but I know a lot of therapists who use this just with general aging, balance risk, fall risk patients. There can be a lot of great techniques that we've developed that can be helpful there too. So I thank you. I wish everybody, please stay safe, especially those of you who are in the acute care now, really in the skilled nursing facilities where we're seeing our patients come back. I think we have a lot to learn how we're going to manage our patients with Parkinson's who recover from COVID-19. And we're so appreciative of everybody who's out there in the forefront of helping patients through this pandemic.
That's true. That's true. So these are all everybody's a hero, frontliners, and we really appreciate everybody. So we're also I'm still in home health. I'm still doing some education here, but I'm still doing my clinical skills at home, and then I just put on hold on my mobile, so at least we can focus more on education as well. So I'm doing more on telehealth as well. So this is great opportunity for us. So thank you so much, guys. So that's for today. We have Cynthia Fox, and she has wonderful idea and great knowledge to inform us about the LSVT Global Incorporation. So check us out. And if you have any questions or inquiries, we can post also the website and also the info, her email, her cell phone numbers, address.
Why not?
Yeah. So again, it's me again, Dr. Jenny Yusuf, physical therapist and doctor physical therapist, and board certified clinical specialist in geriatrics and LSVT BIG certified specialist. All right. So thank you guys, and be safe there. Check us out in our Physiogen PT and Wellness and LSVT Global Inc. for any questions for all the resources. All right. Thank you so much, Cynthia.
Thank you. Bye-bye.
Yeah. Bye for now.
Bye.